Right, so you have a patient who's currently an inpatient, is admitted from the GP with ascites. We've done a peritoneal tap for them, and it showed some malignant cells in cytology. The tumor markers were sent. We don't have the results yet, and the patient is being planned for CT abdomen pelvis, but CT is broken at the moment, and it will not be fixed until after the weekend, and today is Friday. The radiologist offered to do an ultrasound and instead of the CT scan. And the consultant was supposed to speak with the wife, but he had an emergency and went to the operating theatre. And the registrar wrote in the notes that if the patient develops shortness of breath, we can consider a therapeutic tap of the ascites. Your task is to update the patient's wife with the above information. Of course, in the STEM, you will not have all of these information, which I just mentioned, but this will be available in the patient notes. So the STEM will usually say, update the patient wife or the patient son or whatever about the patient current condition, and you'll have to go through the notes and read everything, but these are the summary of the findings. Ideally, and I think I mentioned this in the lecture if we watched it, ideally you should be memorizing these data. I know it sounds a little bit weird to memorize these because they are not particularly medical, but it helps in the exam. That will make the preparation scenario much easier for you. So we'll just be going to the preparation room and checking very quickly what are the adequate information that you need to say. All right, so anyways, so Amna, could you please update the patient, let's call it son, about his current condition?
So I'll start now. Hi,
Please.
good morning.
Hi, good morning.
Hi, good.
Are
I'm
you
one of.
Mr. Mann? Sorry, I'm looking to speak with Mr. Mann. I've been waiting for
No,
all to speak with them,
no,
basically.
no. I'm Dr. Atwal, one of the registrar working with Mr. Mann. And unfortunately, Mr. Mann is not available as he's busy with one of the emergency surgeries. And I'm here to answer all your questions, and whatever you want, you can ask me about the situation. Can you confirm?
All right, yeah, that's fine. Thanks for coming to see me.
Can you confirm your name and your relationship with the patient, please?
Yeah, I'm Abdullah. I'm his son.
All right, Mr. Abdullah. So, first of all, I would like to know that what all do you know about the condition of your father?
Well, not much really. I'm just here to be updated. All I know that the GP referred my father with some sort of fluid accumulation in his tummy, but I'm not updated since really.
Uh, all right, I'll update you about the condition of your father, and just wanted to know that what all do you know about your father, so we can just be on the same page. So, about your father's condition, as you have mentioned, yes, he came to us 2 days back with pain in his tummy, and for that we did some investigations and we took a fluid out of the tummy. We sent it for investigations, which came out to have some nasty cells in that, and that's further
With
gone
nasty cells? What do you mean by nasty cells?
I'm sorry to inform you that, but that could be cancer cells, and we need to confirm it because
Oh.
it's for further investigations. I'm really sorry to
Hmm.
inform you about that. But we don't have a final diagnosis as of now, and for that we need to do a
So,
CT.
doctor, hold on, hold on. I'm just a bit. This is a lot to take in, really. So you're saying that my father has cancer? Is that what you're saying?
I'm so sorry to inform you that, but we need further investigations to come to a final diagnosis. But yes, there are some cells which could
So
take us
what type of cancer is that? Is it liver cancer or bowel cancer? What kind of cancer is it?
at this point of time. I'm not sure about it, and for that, in order to see what type of cancer, we are doing a
What do
CT
you mean you're
scan
not sure? But you just said it's cancer, isn't it?
because the cells show that there is some doubt about it, and we need to confirm that.
I'm not really sure if this is clear to me, doctor. It's either patient has cancer or don't have cancer. I'm not sure if I understand what you're saying.
Okay, I'll try to explain this to you again. This We took a fluid out of your father's tummy that shows some cells which are cancer cells, and from originally it is coming and what type of cancer your father has, we need to investigate more about it. And for that, we're going to do further investigations, CT scan for that, which is one of those. Yes. Am
Okay,
I?
fine. So you're saying that we're gonna get a CT scan to
Yes.
find out what is the source of that cancer cells that you mentioned. Is that
Yes.
correct?
Yes.
Okay. When are we getting the CT scan? We're getting it done today?
Unfortunately, the CT scan machine is not working, and it's gone for the repair, and it would take this weekend. So we'll be able to
I
do
don't get
this.
it, doctor. What kind of hospital is this? So now you're saying that, so you were not sure if it's cancer or not, and the way you explain it seems that it's really urgent, and now you're saying that the CT scan is not working. What kind of hospital is this? Is this
Sorry,
even a hospital that's offering service to patients?
I'm sorry about the situation in a hospital, but usually, in a situation like this, it takes 2 weeks to get a CT scan done. And if anything urgent is required, we would definitely do
I
what
don't get
can.
it really. So you're saying that my father is probably have cancer and is going to stay inpatient for 2 weeks until we're able to do a CT scan for them. And
That
he's
is what
really
is.
depressed and he's severe pain. So just, I don't know. I don't see that you're actually doing anything. Can you transfer him to a different hospital, please?
Uh, I'm so sorry, Mr. Abdullah, but I'll just try to explain this to you. For a normal patient, it takes, for any like situation like this, it's 2 weeks that we consider for doing a CT scan, and it is nothing which is urgent as of now. And if anything that is not in our hands or that requires a patient,
So you think this is not urgent. So what do you say? I'm sorry to interrupt you, but you think this is not urgent. So what do you think about his shortness of breath and he's in severe pain? Is that urgent to you or not?
yes, exactly. That is urgent to you, and that would be taken care of as soon as possible. And for the shortness of breath, we have planned a therapeutic tap. That is, the fluid would be taken out, more fluid would be taken out to
What is the
relieve the.
therapeutic type?
Okay, that will remove the excessive amount of fluid from the tummy, so it would relieve his lungs, and he uh, would relieve his shortness of breath, and we add some painkillers.
Do
So
you think that
he
the cause of his shortness of breath is the pressure from the fluid in his tummy? Is that what you're
Yes,
saying?
this is something that I think is one of the main reason, but I'll have a look in the charts and I will see if there is any other cause of that.
Okay, fine. All right. Well, I mean, the way I'm thinking about it is that I would like to know if you told me now that my father has cancer cells, I would like to know as soon as I can what kind of cancer is it and whether there's anything that we can do about it urgently. So, are you able to offer him maybe any alternative scan that you can do, or even transfer him to a different hospital because he didn't answer this question yet to me? Can we
Uh,
just send him to a different hospital that has a scanner that's working?
I understand your concern completely, Mr. Abdullah. The alternates that we can go for is ultrasound scan and an MRI scan that is of similar importance. And
And
I'll
these are
talk.
working, right?
Yes, I'll talk to Mr.
So
Mann about.
MRI is working at the moment, right?
Yes, MRI is working, and I'll discuss this with Mr. Mann if we can go
And
for
you will
this
be
option.
able to get it over the weekend because today is Friday and is MRI working on the weekend?
I'll have to confirm it with the radiology team and with Mr. Mann. I cannot assure you for that as of now, but I will try to do
Okay,
what is in the best interest of the patient.
that's fine.
Any other questions you would like to ask?
Yeah, I mean, lots of questions really. Do I need to speak with my family? I have my brother lives like 500 miles away, and do you think I need to speak with him to ask him to come in?
I understand your concern completely, but I would advise you that till the time we have the final diagnosis in our hands and we get the further investigations done, if that's possible for you, I would advise you
Yeah.
to till then.
So is he going to have surgery?
At this point of time, it's difficult for me to say if surgery is required or not. Once we get all the investigations done, we have final diagnosis, and we get to know at what stage the disease is, and it will be discussed by a multidisciplinary team, and we'll inform you and we'll discuss all the treatment options with you and we'll update you about it.
Okay. Fine. Yeah. Okay. You said about the short-term support that you're going to do something like a tab for him. Is that correct?
Yes, yes. As I've
Okay.
mentioned you before, that's I've seen in the notes that we're going to do a therapeutic tap. That means the excessive fluid we're going to remove from the tummy.
Sure. All right. Okay. Thank you.
Thank you so much, Mr. Abdullah. If any other questions you have, I'll give my number to the nurse at the reception. You can just get back to me, and any queries, I'll be happy to help. Thank you so much.
Sure. Thank you. All right. So Amna, what do you think? What do you think of your performance?
In the beginning, I just got confused and I just some hodgepodge things in the beginning.
Yeah. Yeah. Anything else? What have you done well that you think? What's the best thing that you think you did in this scenario?
I was trying to answer all the queries of patient and was trying to satisfy him, and I just tried
Yeah.
my best to do that.
Yeah. That's right. And what can you improve next time?
Uh, I don't know. So many things to be improved.
Okay. Yeah, that's fine. No worries. I'm gonna tell you what to improve then. So I'm sorry if I was a little bit silly during the scenario, but this is actually how it is in the exam. So they're gonna interrupt you quite a lot. They're gonna speak quite a lot, and your role is to reassure, listen to them, and then start answering their questions nicely. Okay. So I'll tell you what has gone not particularly wrong, but what can be improved next time. I think your start was good. You started by, despite I tried to confuse you and say, "Are you Mr. Man?" or "Are you the consultant?" I'm trying to find whoever the consultant. Of course, Mr. Man is a man, so I'm not going to say this to a female doctor, but they can just say, "Are you the consultant? I'm looking to speak to the consultant," and this is the time that you need to present yourself or introduce yourself and uh, uh, correct them that no, I'm not the consultant. I'm one of the SHOs. That I'm here to speak with you because the consultant is busy, which you have done so, which is really good. Because sometimes people just would ignore introducing themselves. So that's a good thing that you did. All right. So in terms of you established background and you try to find out what kind of knowledge do I have about the case, which again is a good thing. And then I said, well, I know that they have some fluid accumulation in their tummy. And then you started going into cancer. That was quite, that's the thing that needs to be improved. I wouldn't say it very like directly to the patient. I would try to reassure them first and try to sort of like give them the adequate information. So the way I would say, I'll say, well, your father came in 2 days ago, as you know, by a tummy pain from the GP. We've done some investigation for him and we found that has fluid accumulation in the tummy, as you said. So in this condition, there are multiple reasons for it. So we need to do further investigation to find out what has caused it. It could be from the liver, it could be from multiple other reasons, such as, for example, reasons as serious as cancer. But most of the time, it's medical reasons. So in your father's condition, we've done some investigations, we've sent some samples, and unfortunately, there is some cancer cells in the fluid. It doesn't mean that he has cancer just yet. We need to find out what's the primary source, and we don't know that at the moment. So I wouldn't rush and say that this is definitely cancer, but it's likely, and we would like to get further tests, including CT abdomen and pelvis, and some other imaging, and then see how they take that. So when you said at the beginning that unfortunately it's cancer, so I was like stopping you and interrupting you. Well, so you're saying it's cancer, and then you got a little bit confused when I started asking, well, is this cancer or not cancer? It's because what I wanted to hear from you that it could be cancer, and we don't know the primary source, and we need to run some further tests to find out. Okay, so that's what I wanted
Yeah.
to hear from you, and then I would have moved on to the next talk. So at the very beginning, you can give me the possibilities. The possibilities
Mhm.
here, it could be a disease from the liver, it could be excessive fluid intake, it could be something as serious as cancer. All of these are possibilities, and we need to run some tests. One of the tests we've done is the fluid cytology, and unfortunately, there are some cancer cells. So that is suggestive that he might have cancer. We don't know just yet. We don't know what's the primary source, and I would like to run some further tests. All right.
Okay.
Okay, so the next point is actually talking about CT, all right? And they can even ask you this question. I would answer the question, but try to be a little bit sneaky. So the way you're gonna answer this question to say, well, so just to tell you about the whole process. So we've sent some sampling, as I said, and it's suggestive that it could be cancer. The next step will be doing some images, and after images, don't say the CT. The next step will be doing some images. After that, after we get there, and doing some blood tests as well, and some blood markers, and also making sure that he's comfortable and not short of breath and not in pain. So these are our management plan. And following this, after we have all the results, we would discuss the case in a multidisciplinary meeting to come up with a management plan. So usually the whole process takes up to 2 weeks until the case is discussed in a multidisciplinary meeting. So we have lots of time to sort all of these things out. Okay. So in the meantime, we're going to be doing the other test, making sure that his pain is well controlled, and also his shortness of breath is managed pretty well and looked into. And we would plan to get a CT scan maybe after the weekend, because unfortunately our CT scan is not currently working, and it will not be fixed until after the weekend. Right? So see what I'm getting at. So you're trying to,
Yeah.
you know, break it down to the patient in a very nice way and saying, well, we have lots of time, and it's actually true. You're not lying here. You have lots of time to get some blood tests to get to make sure he's comfortable in terms of his pain and respiration, and also doing the investigation on non-urgent cases. Okay, but the problem with that is, with what I just said, that the patient might just start by asking at the beginning, why does he need a CT scan? And when he said that, again, use the same answer. Well, that's a very good question. I'm going to answer it as a part of the whole management plan. How do you feel about discussing the whole management plan with you? And the CT scan, the answer to the CT scan will be included as well. All right. And then I start, we'll run some tests, we'll get some imaging, and we discuss the management of his pain, the management of his, the shortness of breath, and then discussing the case in an MDT. The whole process takes up to 2 weeks, and the CT scan will be done at this time. All right. So try to be, a little bit sneaky in the way you're going to break it down to the patient. And Justin, if you start by saying, well, CT is broken, and then the patient is going to go into, well, what kind of hospital is this? You're not really doing anything to my father. And then you're going to say, well, it's actually not urgent. And when you say that, well, I'll be a little bit further annoyed, and then saying, well, what do you mean not urgent? I feel like that he's in pain, he's short of breath, so I feel like it's urgent. All right. So, but if you explain it this way and reassure me that the whole process takes up to 2 weeks to get everything sorted and discuss the case, well, I'll have to accept it. Okay. And then I think you answered all the rest quite well, but as separate questions. But if you give yourself like a minute to explain everything and how it's going to happen, that's going to save you lots of time, lots of hassle, lots of discussion with the patient. All right. Is there any, I mean, even after what I said, if the patient goes into, well, but I think CT scan might be needed urgently, well, you can explain, unfortunately, it's not really indicated at this point. However, I reassure you, if the condition gets any worse and we think it's indicated, we're going to have to do it, whether it's a transport or different hospital, or to do an alternative scan such as MRI or an ultrasound. Okay. In terms of the transfer, again, you're going to answer it the same way that I just did. And the questions like, what kind of cancer is it? The answer to it from you was quite adequate. You said that you don't know the answer, which is the right answer, really. We need to find out. We need to do further tests, and then we'll tell you. We'll update you after that. In terms of pain management, you mentioned shortness of breath. I wouldn't say. I know I tried to, ask you further question to get the answer from you. I wouldn't say that it is. We're going to do a therapeutic tap to relieve his shortness of breath. You don't really know that the pressure on the lung is what's causing the shortness of breath. It's one of the reasons, but it's not the exact reason, really. So you need to say, well, I haven't seen the patient yet. I would like to go and examine him and find out what is the cause. However, my impression that it could be the fluid accumulation in the stomach causing pressure on the lung. A therapeutic tap can be considered, which is aspirating some of the fluid in the abdomen to relieve the shortness of breath. All right. The question about telling his brother to come in, um, I think the answer was quite okay. So you understand my worries, and you think it's wise to wait until we have the results and to make sure that it is confirmed or not confirmed. All right. Yeah, thank you. Do you have any questions about this scenario?